Great. Good afternoon, everybody. So I'd like to begin with just a little bit about Brook and about who we are and today's session. So Brook is a national charity supporting people with their sexual health and their well-being. We offer a range of services to support people across the UK in our mission to help them live healthier lives. Last year, we supported 1.43 million people through our unique offer, combining clinical services, relationships and sex education, outreach in community settings, wellbeing programs, and counselling. Our life course approach to sexual health and wellbeing means that people can benefit from our holistic services at any stage of their life. Our safeguarding conference sessions are safe, non-judgmental spaces. We welcome different voices and perspectives, and we want you to feel comfortable and safe to express yourself. We ask that you're open, honest, and respectful when communicating. So my name is Dougie Boyd, and I am Director of Education and Wellbeing here at Brook, and I would like to welcome you all today to our panel event, Safeguarding in a Mental Health Crisis. I'm really glad that you've been able to join us in today's session. This session is part of our 2023 Safeguarding Conference, in which we're presenting 4 panel events. This morning, we spoke about spotting the signs of child sexual exploitation. We're speaking about safeguarding in a mental health crisis now. And this afternoon, we're going to talk about AI and safeguarding and how RSE safeguards our children. These events all sit as part of our wider annual Sexual Health Week. And the theme for this year's Sexual Health Week is Playing It Safe. A little bit about me then. I provide strategic leadership to all of our education, health promotion and outreach work across the UK, and I'm also Brook's executive lead for safeguarding. Having worked for Brook for 8 years, I've watched with concern as the number of children and young people who require safeguarding has increased from about 1.5% of our total service users when I joined Brook to over 4% today. And within that, the rise of young people who we have concerns about, mental health, self-harm, suicidal ideation, and suicidal ideation with plan persistently remain the primary reason for our concern, resulting in about 35% of all of our safeguarding actions. We've spent much time in trying to understand what this means for us as an organisation, what this means for our service users, what this means for young people in general, and what this means for the sector that we are part of. And it's that thinking that has brought us together today. We know we're operating in an arena that is increasingly complex, with higher levels of held and residual risk, while simultaneously experiencing a decrease in funding, in addition to crisis systems that are not fit for purpose, but are also swamped and unable to keep up with demand. At Brook, we think really carefully about our words, and we're reluctant to apply hyperbole when it's not needed. After all, we've got a 60-year history of working in challenging spaces, defying social and societal norms and fighting for young people's rights. Generally speaking, we're not an organisation who is cowed by a difficult challenge. However, we've used the word crisis thoughtfully and deliberately here, framing it against our experience of being a national provider of frontline services and safeguarding provision. We believe that we are in a crisis, that the sector is already under strain, that the spending review, which will follow the next general election, will create significant difficulty for both public and third sector, and that we are unlikely to see a reduction in the amount of young people struggling with their mental health in the short to medium term. At the same time, we have reason for hope and optimism that is deeply rooted in our sector's creativity, ingenuity, and ability to support and reach those who are least reached, most vulnerable, and less likely to be able to access mainstream support. So although it's tough, we don't believe that this is a pessimistic narrative at all. And with that in mind, we've assembled the panel that you see in front of us today. Before we get into the main thrust of the session, I'd like to provide a content warning for us all to be mindful of. In this session, we're going to consider the experience of organisations and individuals working with young people in crisis, and it's likely we'll discuss suicide in different forms throughout the event. With this in mind, please be mindful of what is going on for you as we cover these issues. We've put some support organisations into the chat, and if you do feel you need some support in light of this discussion, please feel free to contact them. Please also remember that you're very welcome to dip in and out of the session event as and when you need to. So with all of that said, I would like to introduce our wonderful panel. We are joined today by 4 people who work in the sector directly with young people, but also shaping policy and shaping strategy. And it's a real thrill to be in this digital space with them. So we're joined by Tamsin Watson, who is the Senior Safeguarding Manager at Young Minds. We're joined by Darren Bassinet, who's the Head of Operations at the Martin Gallier Project. We're joined by Argyrios Terzis, who is Head of Counselling and Designated Safeguarding Lead at the Mix, and by Helen Corteen, who is Brook's Designated Wellbeing and Mental Health Lead. So, without any further preamble, I was wondering if we could go around the panel and take a couple of minutes just to introduce yourselves and to introduce your organisation that you come from. And so if we could begin by Tamsin, I will hand over to you.
Lovely. Thanks, Dougie. It's really, really nice to be here as well and be on this panel. So I'm Tamsin. I'm the Senior Safeguarding Manager at Young Minds. I head up a tiny safeguarding team of 2 at the charity. Our charity is a national charity that works to support the mental health of young people. We work with young people, their families and professionals up and include young people up to the age of 25. So we're working with children and with adults. The way that we work is entirely driven by young people's voices and by their lived experience. So what they tell us we need to do, we follow, we do it. Much of our service is delivered online via our website. So we have lots of advice and support and information there. We also have content that is directly created by young people, such as blogs as well. We also run a parents' helpline, which offers emotional support and advice and signposting to parents, carers, other adults who have young people in their lives if they're worried about their mental health. And ultimately, we are campaigning for improvements to the systems that are supposed to support young people, but I think I'll come to that more later. Just wanted to also say the other role that's name checked in my bio is that I am the lead safeguarding trustee for a little mental health charity called Blink. Blink works to fill that gap when adults find themselves in need of mental health support, but then they just end up on a waiting list rather than with that support immediately. The way that we do it is by going to find people maybe before they even realise they need that support and help. And one of the places we pop up is music festivals. We have beautiful bell tents full of mindful activities. We also have qualified psychotherapists and psychologists who offer one-to-one therapy on site. I hope that gives a little bit of a flavour of the way that I like to talk and think and do about keeping people safe and looking after their mental health. I like to look for creativity, and I like to sometimes be a bit disruptive to the system as well.
Great. Thank you very much. Really wonderful to hear from you. Darren is having some tech issues, so I'm not going to put her on the spot just yet and ask her to do her introduction. We'll hopefully let her computer gremlins settle down. So Argyrios, if it's okay, we could come over to you, please.
Yes, of course. So my name is Argyrios. I am the Head of Counselling and the Designated Safeguarding Lead at the Mix. The Mix is a charity organisation based in the UK and supporting young people throughout the UK. We provide support and information to young people aged 13 to 25, so similar to what Tamsin is doing. We offer a wide range of services, including a helpline, counselling services, online chats, community, and of course a website that is filled with articles and resources on various topics relevant to young people's lives. We would like the Mix to be the first point of contact for young people. So we aim to help young people with issues such as mental health, relationships, employment, education, and overall well-being. We provide a safe, non-judgmental space where young people can seek guidance, information, and have access to support. So that's a very brief introduction to the organization.
Great, thank you very much. All right, Darren, let's give it a try and hope everything works.
Fingers crossed everything works. So, thank you, Dougie. My name is Darren Basnett and I am Head of Operations for the Martingallia Project. The Martingallia Project is a suicide prevention, intervention and postvention charity that covers the northwest of England. And our mission is to create a suicide-safer community by preventing suicide, breaking down stigma and supporting families across the northwest. We offer a range of services, which is all around suicide prevention, intervention and postvention. Prevention-wise, we offer training into the general public and other organisations. We offer suicide-specific training, which is Safe Talk and Assist, and we also offer mental health first aid as well. And the idea is that we are working within the community to create a suicide-safer community. We do work with schools in the northwest, where we create suicide-safer schools and work with the pupils and the teachers for that mission. And then intervention-wise, we offer non-clinical intervention, immediate access to non-clinical support to anybody affected by suicide over the age of 16 and the parents or guardians of those under 16. And that is completely non-clinical. We have a team of suicide intervention workers who have all been affected by suicide themselves and are really passionate about the work that we do here at the Martingallia Project. And then suicide postvention, we offer a number of services, face-to-face, one-to-one, groups, counselling, over Zoom, you name it, we offer it. And the idea of our postvention services is to give people the skills and tools to be able to manage their own well-being and keep them off of suicidal crisis. So that's a little bit about the Martingallia Project. Thank you.
Great, thank you so much. Helen, obviously I'm aware that you and I work together in the same organisation, but it's just clocked in my mind now that I've given the whole preamble around Brook, so may have stolen your thunder a little bit, but I'll hand over to you and it can be as long or as short as you like.
Don't worry, I've put my feet up, Dougie, because you definitely gave us a really good introduction to Brook. I think the couple of things I would add in relation to my role is over the last probably 5 or 6 years, we became aware in our clinical counselling and in education, we've always taken that holistic approach and looking at young people as a whole and everything that's going on in their life. And there was a quality about both them coming to us of their own accord because they wanted to manage their health and well-being, and then our commitment to making that a safe place where we both offered privacy and protection and safety, and we worked hard to balance those two things. And so what we found is that young people were talking to us increasingly about the challenges they had in relation to their mental health as well as the sexual health, and where the two crossed over. And so we wanted to respond more, and we worked with young people to shape predominantly what is some of our responses to supporting young people to improve their own health and well-being, which is one of the key things. So that safe young people were bringing it to us, and we wanted to do more. And that's where my role fits in, because we want to develop more and better and more meaningful responses and keep that focus on young people being able to improve their own health and well-being, because they feel more equipped, more knowledgeable, and most importantly have that strong sense of well-being, that they're worth it, of self-worth, that they're actually worth it. And that's what makes the difference. So what comes with it, which is what we'll be talking about, is some of the challenges. I also just wanted to mention we go to festivals as well, Tamsin, and we have that strong presence around both sexual and mental health for there, and that's really positive, really an active part of what we do. And we also now deliver all age services, so we work with adults as well. So I think I'm happy with leaving it there. Thanks, Dougie, because I think you've explained quite a bit about Brook, so thank you.
Thank you. Okay, welcome everybody. I would like to spend just a little bit of time setting the scene for the people who are joining us in the webinar today, and understanding how we are each experiencing this issue in our different organisations. So I'm going to begin with the same question for all of our panellists. And the question is, what are the current challenges your organisation is facing? Or what have you observed with regards to children and young people's mental health? And has this impacted safeguarding in your organisation? So what I will do is ask people to give us their thoughts, and I will say something like the same question, but if any of you want me to repeat the question, that's completely fine as well. So Tamsin, could we begin with you? What are things like at Young Minds, and what have you experienced?
Yeah, it's a really great question. I've been at Young Minds for just coming up on 4 years now, and even in that relatively short time, we've seen huge changes. So not just the numbers of safeguarding concerns, which has been just going up and up, but also the complexity of those individual concerns as well. So I'd say a few years ago, the majority of the calls that we were getting to our parents' helpline were relatively low-level safeguarding concerns, relatively early presentation of anxiety and depression. That was basically what we dealt with, and we were able to use quite traditional safeguarding signposting for that. More recently, we've just seen a huge increase in concerns that really constitute mental health crises. So where there is a suicidal ideation with a plan, very serious self-harm, eating disorders, for instance. And unfortunately, I think, as we all know, that pattern has gone hand in hand with the NHS just not being able to keep up with that level of demand. So some of those more traditional signposting that we would have done just doesn't work anymore. There is very little point in us directing a worried parent to CAMHS without also telling them that the thresholds are very high and the waiting lists are very long. The other thing that we've noticed is that these mental health concerns are more frequently presenting within a wider context of other risks. So, for instance, young people who are going missing from home, young people who are really struggling with the transition between child and adult services, young people with lived experience of abuse. And the implication for us has been that our helpline team in particular have really struggled to not be just a safeguarding service, and they're supposed to be a mental health service rather than a safeguarding provider. So we've had to respond to that by upping the training for all of those teams, making sure that they feel confident to be able to pull out the nuances of what's going on in those really tricky, complex conversations they're having, and recognise the safeguarding concerns appropriately. That has caused really big challenges with our capacity for that team as well. So one of the things that we've done quite recently is we've entered into a partnership agreement with the NSPCC, so that when we have safeguarding concerns coming up that are those sort of not so difficult that we need to deal with them right away this minute, but also they are quite high threshold, we will pass them over to the NSPCC. That has helped. Also, I know that the NSPCC are struggling with their capacity too, so who knows how long that will last. I would say the other thing that is a particular focus for us at the moment is, over the last few years, we've become increasingly clear about who our audience is and also who our audience isn't, so the people that we're missing. And we obviously know that young Black people, marginalised, minoritized young people are at greater risk of mental health concerns than their peers, and that inequality only exacerbates that, and that in itself has been an increasing pattern due to lots of things, but including the pandemic and the cost of living crisis. And we just weren't reaching those hardly reached communities before. So we're really now working hard as an organisation to centre on being anti-racist, to centre on being more equitable, because we know that if we are able to effectively give support to young Black people and their families, then we're going to do better for everyone as well.
Great, thank you. I think it's a really interesting observation that the pressures that you're experiencing on your capacity, that your helpline is kind of becoming a safeguarding line. I think a few of us in the room can also speak to that experience as well, and yeah, it presents kind of very real challenges to the third sector, doesn't it? When we kind of almost have to find a way of doing the work that we're doing anyway, in addition to doing a full-time job, which is safeguarding. So yeah, it's interesting to hear that you're experiencing that as well. Darren, what are things like for Martin Gallier at the moment? How are you experiencing this challenge?
First of all, I am experiencing technical difficulties, so I'm doing my best to kind of stay here. But yeah, it's really difficult, isn't it? I mean, the Martin Gallier Project is a suicide intervention charity, and we offer that support to families, and we also offer that support to school. And I think especially over the last year, we've seen a massive demand in our service for parents who are supporting their children through thoughts of suicide, suicidal ideation, children and young people who are making attempts on their lives. We also seen a massive demand in schools coming to us and asking for our support because schools were experiencing their young people and their pupils having thoughts of suicide or making plans to end their life. And it was something that we really had to kind of think on our feet and respond to. So we set up our parent support group, which is a safe space for parents to come and lean on each other, I guess, and not feel so isolated and alone when their children are experiencing thoughts of suicide, and get that advice from people who understand as well. And then we developed our school programs, which is all around creating a suicide safer school. So we go into schools and deliver assemblies to the pupils, which gives them the skills and tools to be able to spot the signs, ask the questions directly, and signpost each other, signpost their peers to places that can support them. But I think the demand, echoing what's already been said, the demand on the service has increased significantly. So it's just kind of trying to keep up with that demand for I'm guessing I assume for everybody in the third sector. The young people these days have so much life stress to have to deal with. Like has already been mentioned, we've got the cost of living crisis. Although we don't think that impacts young people, it most definitely does. And then you put social media and the kind of pressures that adds on to young people. There's so much in there, isn't there, that young people have to think about these days, and I think we kind of take that for granted, or the world takes that for granted, that what our young people have to kind of deal with and cope with. And these life stresses, or things that contribute to life stress, are what leads to people having thoughts of suicide, not just adults but children as well, children and young people as well. And I think that there's that kind of idea that children and young people don't have thoughts of suicide, and that is completely and utterly a myth. They do. We see it. But it's a scary subject for some people to talk about, which is understandable. So it's all about, for me, breaking down that stigma within the community. So
Darren, I think we may have lost you. So what we... Darren is clearly falling foul to the internet gremlins. So I'll let our comms team pick up a conversation with Darren about trying to get her back in again. But Argyrios, can we move over to you and have a chat about how the Mix are experiencing this?
Yes, of course. I think I'm going to repeat a lot of the things that have already been said. And it's quite interesting to see that other organizations face the same things. So that's quite interesting. For us, the tipping point, I would say, where our helpline changed from a helpline that would signpost people to being more of a crisis helpline, if you like, was in the pandemic. So before the pandemic, I have to say, I have been with the Mix for 5 years now, close to 5 years. So I've seen the organization before, during, and after the pandemic. So I was able to see this change in our helpline, primarily our helpline. So before the pandemic, we were the signposting place through our helpline. But during the pandemic, it started to become more and more crisis calls. And now after the pandemic, with all the effect that the pandemic had, plus the cost of living, the demand is higher than ever. So totally understand what Tom and Darren were saying. We're experiencing the same. In terms of issues that we see from young people, I would say the majority of it would be anxiety and depression, with abuse as well, and relationship issues throughout our services, not just helpline, counselling and community as well. That would be the most common issues that we would see. Of course, in a safeguarding perspective, all of those topics, anxiety, depression, would be linked into self-harming and suicide ideation, and that's where safeguarding would be involved. The challenge that we see in the safeguarding in general would be what we call CCC, the contact that would cause concern. So that would be people that would contact us multiple times a day or multiple times a week, and that would create a lot of pressure to the team, and it would be difficult for us sometimes to signpost to the right places, especially when we are, as Tom said, signposting to certain places, but the demand in those places as well is very high, so the waiting list is very long. They're coming back to us, requires different signpostings. So that would be one of the challenges, the demand, as everyone is saying. Of course, we're trying to play to our strengths around that. So we have what we call the Red Book, which is a very, very long list of all the available organizations in the UK. So whenever someone comes in through our helpline, we will try to find a tailor-made signposting option for them, something that would meet their needs. Of course, that would mean that we'll take our time to go through their story. What would be the best place for them to go? We also have the peer-to-peer support for young people, especially in our community, which we have found that is very, very helpful. And of course, our counselling services. Our counselling services do not have a waiting list. So it's whenever we have availability, people will go and book it right away. I would say the shortest that you can wait for a session is 2 days. The longest that you can wait is a month. So still, there is some time to wait, but nowhere close to what NHS, for example, is offering. So that's what we're trying to do to support people, especially with safeguarding, what we have seen. Yeah, I think that answers the questions, Dougie.
Thank you so much. I was speaking with your CEO last week, and he told me about your wait times for counselling, and I was absolutely staggered by them. So yeah, we can see what a valuable resource that must be. Helen, what are things like in Brook?
I'm definitely going to be sharing some of the things that everybody else has shared. We see exactly the same, and I think same as you've just said, Argyrius, I think it's important and strengthening that we all experience the same, but it also needs to galvanize us collectively to action, and also for people to hear us, you know, because I think we do the best with what we can, but there is definitely something about that it's not isolated, it's not pockets, there are universal experiences here. So I will be talking about those, but what I wanted to start by talking about is the range of challenges that we face supporting children and young people to navigate adolescence and puberty through our education, clinical and counselling service. And when we look, although we have definitely in the last 3 years seen an increase in our safeguarding concerns, the vast majority of young people that we are working with are, and our base to work with young people is about supporting them to manage and improve their own health and well-being. We take that holistic view of health and well-being, particularly the connections between sexual health and mental health. And at some point, if the opportunities arises, I'll talk about some of the conversations we've been having over this summer to strengthen those connections. So the majority of our work is with young people who are managing that, working their way through all of the challenges and changes they bring at that stage in life. And I think one of the things that I wanted to highlight about that in relation to safeguarding is that safeguarding starts as soon as we're with a young person, and our education specialists, our counsellors and our clinicians at Brook are exercising, they're listening, they're paying good attention to young people, and they're making those safeguarding decisions throughout that whole universal area of work that we're involved in. And I think it's important not to underestimate that aspect of safeguarding, as well as the point at which we identify or hold a concern for a young person. So we have all of those challenges have increased and changed as well in that area where the majority of young people are doing well or doing well enough. They're making their way through it, they're becoming more equipped to manage their own sexual and mental health, as well as their general health and well-being. But we do have programs of work. We offer counselling, our clinical work, and our My Life program, which we have set up to support young people to improve their own health and well-being. That's the focus of that program. That's where the majority, when we look at our safeguarding concerns, that's where the majority of our safeguarding concerns come from. And in part, it comes because we create that safe space. What we have definitely found in our counselling and in our My Life programme, we give information, and I was interested but what you said about Tamsin, about what you do and what you don't do, being really clear what we can offer, what we can offer safely, and what we can't offer. And we found that's being pushed, and it's pushed in part because of the demands elsewhere, and pushed because thresholds are high. So where we have those services running, we find that the referrals come in. There's one element which have the adult perception of what is an issue of concern for the young person that comes through. But when they sit down with us and we say, let's hold on to what the adults are thinking, and where are you? What's important to you? Often at that point, we may hear something that is different, something that they haven't been able to say to other people, that raises risk. So what we've had to, and concern, and we've had to get better at judging when the referrals come in for our counselling and our My Life programme as to whether they are within what we can safely offer. And we've had to introduce something and support our colleagues to recognise when that emerges, because when you sit down with the young people, there is a greater level of need, because there's a sense of isolation and young people trying to manage things by themselves. And when they do sit down with an adult that is interested and willing to listen, that's when they're able to open up. I think we've experienced exactly the same in terms of more complex, more interconnected issues and a greater level of distress and impact. We have referral processes and triaging for both our counselling and our My Life programme. We do have appointment-based, but we also have walk-in services in our clinical services. So sometimes that's a point where, because of the way our clinicians do their consultations in exactly the same way, that's where we hear, and that's where young people disclose. And we directly ask about mental health, and we directly ask if people have thought about suicide, and that makes a big difference, because then they feel that they can tell us. I think in terms of the implications for suicide, for safeguarding, it's rightly time consuming. Rightly, it takes our time, and it is of concern. Our frontline colleagues are so committed to keeping young people safe, to equipping them to manage themselves, that there's a sense of responsibility and concern that comes with that I think it's important that we don't overlook as well, because there is an impact where you hear things and you're not quite sure where that response is going to go, what you can do about it. And we are definitely left holding concerns, and sometimes our clinical colleagues are holding concerns while we wait for a response, or while we hear that the threshold for response is too high. Last point, and then I'll finish. What we found is our own, unlike yours, Argyrius, I was really interested to hear that we have a mixture of waiting lists, but what we definitely see is where we have My Life and counselling programmes, we have projects where a 2-year target is met within the first few weeks of that project being open, and we have our referrals coming in at that pace, and our waiting times are building up, and it means often young people are just not getting the time. You know, you get a time limited response because that's how services are structured, but they're not getting the time they need.
Thanks so much, Helen. Argyrios, the question and answer box has been jumping with questions about how the mix manages wait times. So when we come to the question and answer session at the end, I'll probably be shuffling that one your way. Tamsin, Young Minds recently published a really fascinating report called Deconstructing the System. And I think it foregrounded young people's voices in a really interesting way that we haven't quite heard before. So I was wondering if you could tell us a little something about the findings of that report, because I think the people watching the webinar would be really interested in that if they haven't come across it already.
Yeah, of course, I'd love to. I'll try and distill it down to some highlights and just encourage you all to go and read it. It's on the website. So this report was the result of surveys, questions that we asked to over 10,000 young people. And it was really to ask them about their experiences of their own mental health, looking after it, the kind of things that affect their mental health. And basically the thing that came out of is the big thing is that they said that whole systems around them need to change in order to improve the well-being of children and young people. They all came from very different backgrounds with very different lived experiences, but it was clear from all of them that they just felt that the world they're growing up in is having a really detrimental effect on their well-being. I will throw a couple of stats at you because they are illuminating, they're staggering, they're scary. So for instance, over half of the young people that we talked to said that their place of education harms their mental health. So young people are telling us that this place that we send them, that we as adults think should be caring and nurturing, is actually actively harmful. So we really need to start thinking about young people's experiences. It's like what Helen was saying about how adults have a perception of what's going on, but young people tell us what it's really like. And that theme of services that don't really do what we think they're supposed to do carries on when we talk about mental health services. So 60% of young people who were on a waiting list, or nearly 60%, I think it might be 59, on the waiting list for mental health services, said that their mental health got worse while they were on that waiting list. And 15% of them sadly attempted to end their life during that wait as well. That system isn't working. It's not fit for what they need. The young people are not getting the support that they deserve. It's coming through loud and clear. In addition to that, looking a bit more widely about young people's sort of hopes and dreams and what they're thinking of for the future, 9 out of 10 of them said that they were worried about earning enough money in the rest of their life, 90%, and a similar number also worried about loneliness and isolation. And when young people are worrying about those real basics in life, you know, the ability to have somewhere to live, have enough to eat, to have a community supporting them around them, they're not able to think beyond that and look after their mental well-being as well. Their resilience is really, really impacted by those things. They told us that they feel hopeless. And the other thing that came through in the report is that the experience of young people who are Black, minoritized or marginalized is even bleaker. They have all these experiences, but they're also magnified by their experience of racism, discrimination, homophobia and sexism. So I'm going to stop with the depressing statistics there. There are lots more. But I think what we need to look at is thinking about, well, what are we going to do? So we've listened, we've asked the question, we've listened. Who is going to start putting that right? And one of the things that also came out in the report is that only 7% of young people trust our government to have their best interests at heart. So it's not the government. That's not where we need to look. We need to find ways of making ourselves as a sector, as professionals that work with young people, a trustworthy place, a place that is really worth their trust in us to make things better for them. I think as a sector, we need to really broaden our view of what is impacting young people's mental health. Stop looking at it on a purely individual level, although that is really important too. But we also need to look wider. We need to take a step back and look at the society, what's going on nationally, even globally. You know, we talked to young people about the impact of the climate crisis, sort of big political things like war as well. They worry about these things. They're on their mind all the time. And once we start looking at things in that context, I think it becomes really clear that what we're all trying to do as organisations are just like little sticky plasters on this big gaping wound that we can't really fix. We're sort of enabling young people to get by as much as we can, but we're not fixing those underlying sort of systemic problems and failures. So what Young Minds is hoping to do now is to turn those findings, all these things that these young people have said to us, into a sort of tangible work plan. That's not going to be easy. We are not going to be able to do it on our own. We don't want to do it on our own. We want to involve lots of you who are, you know, on this panel and listening to this presentation as well. We need to find the right people to help us do this. So whilst we're going to continue with the work that we normally do, which is campaigning for reducing waiting times and improving the education system, for instance, we are also turning as an organisation to look more at the structural inequality that exists and what we can do to change that, because that is essentially what this report has told us that we need to do. So I will be really interested. I hope there are some questions about this. I'd like to be able to talk to others about what, you know, what they're seeing is mirroring this, how they are approaching it as well. And like I said, I would go back, really do go back and have a look at that report. It's all very much in young people's own voices. And I think it's one of the most powerful bits of work that Young Minds has been involved in, certainly in recent years.
Thanks so much. We're picking up loads of questions in the question and answer box. We'll have to do some curation of them, but I'll definitely make sure that we have some time for them at the end. And in the charity sector, we love producing reports, and I'm sure everybody on the panel, we read loads of them. I really sat up and took notice of deconstructing the system. It felt like a very different type of report, and one that we'll probably ignore at our peril. Argyrios, the mix kind of occupies a really fascinating space in the youth sector ecosystem, because you're pretty much predominantly digital, you operate digitally. So in the delivery of things like your general chat or support circle sessions, do young people discuss their mental health, and what challenges do you find in keeping them safe?
We are digital. Everything that we offer is online. And this allows us to reach more people. So that's the I would say the major benefit of it. So we are able to reach people that otherwise would not be able to come into receive the support that they would need in a face-to-face environment, because it's a little bit more difficult to do that. In terms of keeping them safe, before I go maybe into keeping them safe, I have to answer the question if they talk or not about their mental health on the online world. And the answer is kind of easy. They do. Yes, they do want to talk. So having a space to be able to do so is valuable. So we see that people do talk about their mental health. They have that need. Now, in trying to keep them safe, and that's of course where the challenge is, we have ground rules, if we could name them ground rules, that keep them safe, especially in our community when it is a group of people communicating about their experiences. We have moderators that moderate the chats that are happening in the community, and I would say we're quite strict with those rules in terms of they're able to talk about their feelings, their experiences. But if something starts to become more triggering to other people, or there are certain experiences that would be triggering to the rest of the group, then one of the moderators would remove that person, for example, from the group, and would have a one-to-one conversation to find appropriate signposting for that person, and also explain that the group is not a place for crisis. that there are other appropriate places that we offer in the mix and outside of the mix for that reason. So that would be a way of safeguarding the young person that would be in crisis using those group chats, but also the rest of the group that is there to communicate about their experiences. In the helpline environment, the safeguarding or the support, the way to keep them safe, basically, the young people, would be mainly through our signposting and risk assessment. So our helpline is trained into the risk assessment, and they are offering their time to go through the story that the young person is sharing to make sure that they're offering the right signposting options. Of course, we also have what we call the core plans. So core plans is a way for us to put all the information that we have for that young person in one place. So we will have a unified approach if that young person comes back for the same issue. So that would be for a person that comes back to us multiple times during the week or the month, that we have a unified front. So anyone that would answer the phone in the helpline would know the background, but also where to signpost, what we've done before, and what is our course of action moving forward. Another approach that we have to keep people safe is the so-called M messages. So M messages would be pretty much a faster core plan, if you like. So we have the core plan, and if a young person comes back that is a high-risk person that we would need to immediately signpost to emergency services, we would have a pop-up that would come up that would say, we've done that before with this person, so act quickly, do the same thing. So this would help the person being on the helpline to signpost as soon as possible. So that would be our way of keeping people safe online on our community and helpline. The counseling area is a little bit different, I would say. It's just because there is this, you have 8 sessions, for example, in front of you, 4 or 8 sessions. So there is this continuity. So in counseling sessions, we've noticed that the risk is much lower compared to helpline or community, especially helpline. So whenever the counselors that are, of course, trained counselors believe that there is a need to risk assess or to safeguard, they would have their own call team that they could call and bounce ideas back, if you like, of should I break or should I not break based on what they have disclosed. And through that, we will continue. Basically, the on-call team would require to make the call, decide if we're breaking or not. So yeah, that's the way that we keep them safe.
Great, thank you so much. Helen, then, so in our face-to-face work, we've seen an increase in the number of young people who are experiencing suicidal ideation and the number of young people who are experiencing suicidal ideation and have a plan. Could you talk a little bit about Brook's experience, your experience in relation to this?
Yes, we definitely have seen an increase in that. I think there's something I'd just like to say about language as well. I think suicidal ideation and suicidal ideation with a plan are the way that we categorize it, but that's not necessarily how it's experienced. It's experienced from young people's point of view in that sense of confusion, you know, where they're experiencing trauma. Some of the things that we've been talking about, you know, in the report that you've explained, Tamsin, and it's brilliant that you've asked young people those questions. Now we've heard the answers and we have to do something, because that's what young people are struggling with. So that's the reality that's behind the words when we say suicidal ideation. And suicidal ideation with a plan is where young people are feeling overwhelmed and they intend to do, they've taken another step to intend to do something about that. And I think distinguishing between the two can be really worrying, and it can be really difficult, because we know statistically people will think about suicide and will think about it as part of the level of distress and often their isolation that they're experiencing. And it's different when it takes a step in terms of planning that. I think one of the things that has helped increase it, so we see the increase partly as a sign of the things that people are struggling with, but also as a part of the sign of our intention to ask that question and to open that up for conversation. Because what young people told us through our counselling services is that it's a difficult thing to talk about, it's a difficult thing to share. People often, I think you said it earlier, Darren, people don't take it seriously, that's how a young person is feeling. So we've integrated it in the way that we talk to young people about the additional needs that they may have, and we've incorporated in all of the things that we know are markers for young people's health and well-being. So I think that's been an important part of it. And for young people who are a little bit surprised by the question, and I'm fine, why are you asking me that? They, we're equipped to have that conversation about why we are asking that question. And there's a reassurance, oh yeah, I see, well, I'm all right, but I see. And even if they're not all right, and they're testing us and they're saying they're all right, they're still putting that in front. They know that that's there, and they know that that question will be returned to, because young people take their time to trust and take the time to be able to gather what they're saying and what they're feeling. So what goes with that is how difficult it is to make that distinction and to know when it's safe to listen and when it's safe to explore with a young person. And actually we need to take steps to disable a plan to get a greater level of support and to do an immediate response to keep those young people safe. That, I would say, is ongoing and live and will remain so. That will remain something that we have to consider and think about every time that comes to us. We want to get better because we know that is difficult, challenging and distressing. And I think we've worked hard at Brook to recognise that the impact of doing this work as well, and to offer support and understanding as we skill people up. We don't overlook how hard that is to do that and to make that distinction and carry that responsibility. So this year we strengthened the guidance to help us to do that. We've strengthened the structures that are around people so people can get support from their managers. We have a designated safeguarding team, very similar to yours, Tamsin, but great in terms of the support that it offers. And we have an escalation team, Dougie and I are both part of that, where they have access anytime a service is running to the support of a senior manager. And we've created that culture, that decision making and thinking through and helping us to see what needs to be put in place immediately, what can we continue to offer and do, what else do we need to have in place, and where do we take immediate action to keep a young person safe. Is not left to any individual. That's a collective and team response, and that's a really important thing for making the best response that we can for a young person, and also looking after ourselves and supporting each other. I think the last thing I would say in relation to this is that it's a point I made earlier. It's rightly time consuming, but because we have amended our systems, we keep track of every single safeguarding concern that we have, and we keep hold of them, and they are actively reviewed until we have achieved a safe outcome, and we hold on to something until a safe outcome is achieved. But sometimes that takes a long time because there's a delay in response. The thresholds are too high. Even where there are thoughts of suicide, the thresholds can still be too high. So ongoing, Dougie, it's ongoing and it's live, and we want to continue to do it better and continue to support each other. And I think that's wider. I think what I'm taking from this panel is it's wider. We're all trying to do that.
Yeah, thank you. I think a really interesting point, Helen, and I'm going to kind of almost disagree with you, but allow both things to be true at the same time. And when you mentioned that young people take time to trust, you're dead right. But once young people trust an organization, actually, once that organization has that reputation for trustworthiness, they're actually very quick to disclose, aren't they? And so but it's interesting that both those things are true at the same time. Darren,
it's good to make that point, Dougie. Thank you. It's a good point. That is a good point. It's
funny that we experience both, isn't it? Tamsin, I'm going to come back to you if that's all right. So you foregrounded twice about the intersectionality of kind of vulnerabilities that came up from the report. So could you tell us a little bit about your understanding of the relationship between discrimination and mental health, and how that affects safeguarding practice?
Yeah, I'll do my best. So the report that I spoke about a little bit, but also lots of other work that we've been doing recently at Young Minds with minoritised and marginalised young people, has really highlighted to us that there is inbuilt racism and discrimination in so many of our systems. And that includes health system, education, the police, the criminal justice system. And that to me is really interesting, because on the face of it, all of those systems should play a really positive role in safeguarding and keeping children and adults safe. But in practice, we know that's not actually how it works out for many individuals in our society. One of the other findings that came out through our survey and is mentioned in the report is that 50% of young Black people told us that police and law enforcement negatively impact their mental health. So we also know that we get similar stories through from, we have a wonderful group of youth activists at Young Minds who all have lived experience of poor mental health. And we also engage with lots of young people, particularly online through social media, for instance, and we hear their stories too. And they often tell us about negative or harmful experiences of sort of so-called safeguarding practices that they have experienced. So things like the Prevent programme, or others have told us about undergoing searches at school. And all of these things would be couched in terms of being a safeguarding practice. But I really struggle with that as a safeguarding professional, to understand anything that can cause harm to an individual or community and places somebody's safety over somebody else's safety, prioritises safety of a group over another. I really struggle with talking about that as safeguarding. And I think the other sort of thing that we need to be really aware of here is that the same young people who are more likely to experience poor mental health and also then poor care for their mental health are exactly the same young people who are more likely to experience poor safeguarding practice. So they're getting this kind of layering of potentially really, really challenging experiences, potentially traumatic experiences. And one of the things I've been grappling with over the past couple of years is that this leaves people like me, safeguarding professionals, with a problem. And I think I'm especially aware that part of that is my own identity. So I'm a white cis woman. I'm fairly well educated. I have a very particular view on the world and on the services that I engage with. And I really need to learn to take those glasses off and look at it with a different viewpoint, or engage other people, to tell me what's actually going on. And it's made me look at things in a different way. So, for instance, our safeguarding policy says that if anybody is at immediate risk of significant harm to themselves or to other people, we should call 999. I'm pretty sure lots of other people here will also have that written in their policy. But then what do I do if I'm faced with a young person who's been traumatized by repeated interactions with the police, or who's been really let down by a mental health service again and again to the point where they've completely lost trust in them? Or what do we do when we have a parent come and tell us that they're really concerned about their child's self-harm, but they just can't bring themselves to put their faith into a statutory service that doesn't recognise their cultural needs? What do we do then? Because I don't think 999 is the answer. So we need to try and have this balance between knowing that we need to take action. We can't do nothing as safeguarders. We have a duty of care, but how do we carry that out? So at Young Minds, we try to take a more nuanced approach to safeguarding. It sounds like my fellow panelists do very similar things, which I'm really, really pleased to hear, in that we're really looking at the individual and their particular context as well. And what we're trying to do is to give the people that we're supporting, but also my colleagues who are managing these things, these concerns, more choice. So we might work with a young person to risk assess the sort of potential of different outcomes, so we'll work with them and say, so if we do contact the police, what's that going to look like for you? What are the potential outcomes? How can we mitigate it? If we don't contact the police, what are we going to do then? And what might be the outcomes of that? And working with the young people in particular really helps to foreground their views, and it puts them in a lot more control, which in itself can be really, really important in terms of managing the concern. We also work with young people to try and understand the protective factors that they have that might not be immediately obvious to us. Or to me, with my, like I said, my particular viewpoint. So for instance, really strong community support can be such a great protective factor, but unless we ask about it, we won't necessarily know it's there. I might not make an assumption that it's there. We've also slightly changed how we phrase things in our helpline. It really can be that simple, just a little turn of phrase. So for instance, when our helpline advisors now are giving advice or signposting, we don't just expect our callers to act on it. We always check in with them, and we always sort of say, how does that sound to you? Or does that sound like something that's going to be okay for your family? And if it's not, then we'll try something else. And like Kagura says, we have our red book and we go back and we find something that might be more appropriate. So I think that's partly how we're sort of trying to manage to improve our safeguarding practice, by just being aware that there are so many potential influences on people's risk and protective factors that we need to take into account. I also make it my business at work to have difficult conversations with my colleagues. So we will talk about, when should we call 999 in a crisis? And actually, why are we making those decisions? What is about my life experience or my bias that might be impacting the way that I respond? And I think that also comes down to something that Helen said about it not being an individual decision ever. We work as a team. And although we have procedures and protocols that are in place, we can always check in with each other and always try and get somebody else's point of view. And it makes it so much stronger and safer for us if we can do that. I don't have all the answers to this at all. This is a process of learning, and I'm right in the thick of it. And I think that will continue for a long, long time. But it's something that I'm really interested in us trying to get right, to not just assuming that the systems are working, because I just don't think that is how we're actually going to move forward with this. And I think also, just coming back quickly to what Helen said about looking after ourselves as well, I'm really conscious that my colleagues need to know that we're working in this sort of anti-racist, anti-discriminatory and trauma-informed way, because that helps them to manage their own, vicarious trauma and their own well-being as well. It's really, really powerful.
Great. Thank you so much. In the spirit of being within the thick of it, Darren and we are going to jump into it now. We're going to trust the internet connection and hope for the best. So Darren, your organisation, you've got a really long history of working with young people at, in immediate risk of serious harm and crisis. And I was wondering if you could tell us a little bit more about what you think young people in crisis need the most. Darren, you're dropping in and out. Is there any chance you could switch your video off and let's just see if we can hear you? Great, your video's off now.
Is that better?
So, well, that's sounding better. So let's go.
Oh, so you can hear me now, yeah?
Yes, we can, and it is really clear. So,
Okay.
yeah, I think you're good to go.
Okay, fingers crossed. So I think it's a big question to ask, what do young people need? Because every single young person is completely and utterly different and is going to need something different. And I think we need to look at it on an individual basis. But if we try and kind of look at it overall, then most definitely they need empathy. They need us to understand They need us as adults, as professionals, as the community to respect them as human beings. I think that there's a lot of children who talk about their mental health or express thoughts of suicide or make plans for suicide or make suicide attempts. And there's this kind of, and not everybody is the same again, but there's this kind of overall feeling that children and young people are doing this for attention. And I think that needs to stop. There's no two ways about it. Even I get on my high horse about it, really. Anything in relation to suicide needs to be taken seriously, regardless of what the caregiver or the school or the professional working with that person, whatever their opinions around suicide and self-harm and mental health is, the suicide needs to be taken seriously. So I think saying that children are making attempts or expressing suicidal ideation for attention needs to stop, because that's just not helpful at all. And I think that we as the professionals and the adults here need to respect children as humans. We need to show them empathy. We also really need to be educated ourselves on how to create safety and how to work collaboratively with young people to create that safety. I have worked with so many parents and schools and adult support and children and young people who don't understand how to talk about suicides appropriately, who don't know how to disable suicide plans, who don't know how to create safety plans. And we can't know what we don't know. We don't get taught these things, do we, unless we put ourselves out there and learn. So I think I would urge anybody who is supporting young people to learn, to get educated, to go and put themselves onto some courses, onto some workshops, onto some programs, whatever that might look like for you. Because the more that we are educated, the more that we understand, the more that we know things, the more we can support our young people. And I think just being able to talk about suicide makes a massive difference. Being able to say that S word that everyone's so scared of is so important, because it breaks down that stigma, and it makes young people know that we are here, that we can talk about suicide, that we are able, willing, ready to have those difficult conversations. And yes, those conversations are difficult, but they need to happen. I think that it's imperative for not only preventing suicide in children, but also these children are our next generation. They need to know that it's okay to talk. They need to know that it's okay to have thoughts of suicide. It needs to be normalized, within our society. And that starts at school, doesn't it? That starts at school. The young people need to be given the skills and tools to be able to recognize the signs that their peers may be having thoughts of suicide, to how to ask that question clearly and directly. Are you having thoughts of suicide? And understanding how to ask that question in an appropriate way, and then how to signpost their peers to places or people that can support them, i.e. teachers, parents, services. But then it goes bigger than that, doesn't it? The children then and the young people then also need to know that they're being signposted to people that can help, people who have got the skills and tools to be able to help, people who have been trained. It's all right, it's all well and good saying, go and speak to this teacher or go and speak to your parent, but if that parent or that teacher doesn't know how to deliver that non-clinical suicide intervention, that's all going to fall apart, isn't it? So I think it's a really big question on what our young people need. Our young people, in my opinion, need us as the adults, as a community, to come together and get educated on how to deal with a crisis. And I think that answers that, does it?
Well, I think you've been really polite, Darren, because I've just been reflecting on that question, and actually it's a giant question to have posed to you in what is a very short space of time to answer, but yet that was really comprehensive, so thank you very much. Argyris, I'd like to ask you a really technical question now. How does the mix navigate the complexities of safeguarding young people who are engaging digitally and online, but for whom you might not have a name or contact details for?
This is a difficult one. Whenever we have such a case, no name, no contact details, we are a little bit stressed. Not going to lie, there is stress in the team of what kind of information do we have. The good thing about our services being online and being accessible through internet is the IP addresses. So we do have that IP address for most of the contacts that we have with the young people. Now, if it is a safeguarding concern and we would need to break confidentiality or reach out to someone of the emergency services, we're mainly doing that with the Metropolitan Police. We have a direct line, a very good relationship with Met Police, and I would say they are maybe the best in identifying an IP address and where this is coming from. So we've built that connection there with the Met Police to get people, to get the support to people that have not given us a name or the other contact details. Most of the times, because our sessions are not just sessions, but our contact with young people will be through phone, we also have the phone number. So that's another thing that we could potentially provide, even if we do not have a name. The phone number, the IP address, and when we say the phone number, we don't just give the phone number, but also when it started and when it ended, down to the last second of that phone call. That way, the Met Police again can identify the person. So that would be the main way, practical way, that we would safeguard people that have engaged with the services online without a name and maybe not all of their contact details. Of course, if we have an email address, we will provide the email address as well. Through our counseling, for example, if you want to book your sessions, you will probably need to provide an email address. So we do have your email address. This is not ideal, of course. Just an email address would not be helpful for someone that wants to identify you, but it can be quite, it can be something at the end of the day. And in the sessions as well, in the calls, we would try to get information from young people. So through the risk assessment and through trying to understand what is the best approach to support the young people, we will try to get as much information as possible if we realize that the call is going towards a break, it's going towards a safeguarding concern. So we'll try to push a little bit to get as much information as we can. For example, where in the UK they're based, or what is available in their area if they would like to do something there. But worst case scenario, as with your question, no details, no name, we would only have an IP address. And if I'm not mistaken, we had that a month or two ago, that we had to give that information to the police, and it was pretty much an IP address that we gave them with unknown name, unknown telephone, unknown email number. That's what they disclosed to us, an IP address. So that is that is how we deal with that. But as I said, it's quite stressful when we receive such a distress call with no details, because we want to help, but we don't have everything that we need to help in such a case.
Great, thank you. Okay, I have been wildly ambitious in what I was hoping that we could cover in this session, and I would really like to carve up some time for the question and answers that we've had from people who have joined the webinar, because there has been many and they have been varied. So I'm going to be a little bit arbitrary now, if that's okay. So Argyrios and Darren, I was wondering, we've had a question come in from Adam, which builds upon what we were just talking about. Adam has asked how much confidence we have around the 999 call once we make it, that the individual will get their needs met, that they will be supported, and that they will be listened to. Darren, if you're with us, do you have any thoughts on that?
Absolutely, yeah. Can you hear me?
We can, yes, thank you.
Yay! So I think our offices are based on the Wirral and now in Chester. We've just opened our second base in Chester, and we are really, really lucky that we have managed to build a relationship with the police here in our local area. So we have also trained some police officers as well in applied suicide intervention skills training, which is a non-clinical framework on how to do a suicide intervention. So we are confident in the police that we send in our local area. And to be honest, I think they have that confidence in us as a service as well, because calling 999 is what we call activating safety first. And we will only do that if there's immediate risk to life. And you know, we've gathered a lot of information while having a conversation with a person, and we'll only do that if we are unable, if that person is unable to participate in an intervention. So, for example, if they're having a serious mental health crisis like psychosis, for example, or they're under the influence of drugs and alcohol. So us having all this information, building that relationship with the police has really become imperative, really. And we've also got street triage on the Wirral as well. So that's like a police officer and a mental health practitioner from liaison psychiatry going out together to mental health crisis. And again, those services have been trained in applied suicide intervention skills training, and we work really, really collaboratively with them. So I think that is really lucky for us, and it's took us, you know, 4.5 years to get to that space. But you know, it's imperative, really.
Argyris, in the same vein, so you know, when you have the information that you were speaking about, what's the mix's experience of calling 999?
Yeah, as I said, we have a quite good relationship with the police. You say 999, we do not call 999 ourselves, just because we have a different number we have a different connection there. But yeah, it is 999 at the end of the day. But so we have a good relationship. We have, you know, not trained them, but we had a connection so that they know who we are, and we know what to expect from us, what kind of information and what kind of work we are doing. So every interaction that we have had with the police so far has been, like, these 5 years that I'm with, has been great, I have to say. There is this duty of care. So when we're transferring that information to the police, they kind of have to respond to that. And what we have noticed many times is, because we are UK wide, so we're supporting not only London, for example, we're supporting the whole of the UK. There have been questions sometimes from the police: why do you come to us? Why don't you go to the direct police station that is to this place? And that is why we built that relationship with the Met Police. So we're transferring everything to Met Police, and then Met Police would transfer that to the police station that needs to act on that call. I would say we trust it very, very much. Yeah, we do trust the process that they would follow on what we've given them. The thing is that I would like to exist, but it doesn't, for us to have an feedback in a way, like we did do it or we did go there, but that's something that the police, of course, does not offer back, saying we did act on that and this is the outcome. We will find out the outcome from the young person. If the young person comes back to us, if it is a counseling session and there are sessions booked, we will find out probably what happened in that call, and we will have the time to explore how they experienced that. If it is a telephone session, a helpline call, we might not learn what happened in that call, but we do trust that they do it.
Great. There's a whole new webinar, isn't there, in looking at what this feedback loop is between, you know, Young Minds' Deconstructing the System report and those experiences and our experiences. Fascinating. Helen, can I shoehorn in one final question, which came in from Lorraine, which I think is really interesting, where she asked just for a little bit more information about knowing when it's safe to listen and explore, which was something you touched on earlier.
I think one of the things that is a challenge when we're thinking about a young person who is thinking of suicide and determining whether they have a plan in place, and so immediate action is required. And so that is a process to form that relationship with that young person in the time that we have, so that it's safe for them to explore that, so that we can then identify that there is a plan, or that there isn't, but but they're thinking around suicide because they're feeling overwhelmed, or they're feeling whatever it is that's prompted that feeling, but there is no plan or intention. So there may be a little bit more time to explore that. And for us at Brook, we don't have counselling services in all of our services at all, but where we do have counselling services, that can be really useful, because at that point we've picked up that there's a need to, you know, the worst thing is that young people talk about these things. We decide there's not an immediate risk. So it's almost thank you and goodbye, you know, there's nothing we need to do. Well, there is, because exactly what you said, Darren, that every time a young person is talking or thinking about it, we stay with them and we work with them to see what that means to them, to help them move past that. So if we're not able to do that, the important thing is to get that to support a young person to go where they will have the time. You hit the challenges of waiting times there, but it's still important that we don't give up and we do that. But that decision making, that was what we were referring to, is when immediate safety action is required to keep a child or young person safe immediately. What Agirios you've just been talking about there, and Darren in those emergency responses, and when it's safe to do what we're doing with them at that point of contact, or support them to access ongoing support. The other thing I wanted to say, it's not quite related to this question, but it's a bit to the overwhelmingness of what young people have told you, Tamsin, in that report. There is something, and it's something I always take heart from in trauma-informed approaches, that we're faced with all of this, and we should be equipping young people to be political and to understand and think critically about their world and get engaged, you know, so that's part of that. But actually every time we build that trust and every time we have that contact with each other and with young people, that can make a difference whilst we've got this sea of challenges. And that always gives me heart and hope, because those kindnesses and that way of looking and listening and being honest when we don't know what to do, but we'll figure it and we'll stay with you. We'll stay with you while we figure it out. I think that is, and it helps us to keep hopeful in the face of something that looks like, what on earth are we going to do? Where do we start? We start together, and I think we're so appreciative that so many of you have joined today to be part of that. I just wanted to say that, Dougie, that last
Well, what a brilliant way to end, and you've wrapped it up quite beautifully for me. So thank you very much. Argyrios, Darren, Helen and Tamsin, thank you so much for giving up your time, your energy, your expertise. We all have about another hour and a half's worth of webinar in us to unpick some of this stuff together, and I'm sorry that our time has been so limited. Thank you very much to everybody who has joined. To use Helen's phrase, heart and hope. Some of this stuff is really difficult, but we're here, we're speaking about it. You've joined us to learn about it. And I think that should give us great heart and hope. Loads of questions have come in through the Q&A, and we will try and unpick some of those outside of the session. And if we can answer them, then we will do. And I'm aware that our comms team have just put on a kind of conference session feedback. So if you do have any time to fill out that form, that would be brilliant. Okay, thank you so much for joining us. Thank you for taking part in the panel. Thank you to our comms team for supporting, and let's carry on the conversation and the work offline. Thank you again. Take care and have a good day.